Okay, we'll go ahead and get started. Good afternoon, everyone. I'm Steve Connick. I'm the Linn County Emergency Management Coordinator. Thanks for your attendance today. We have a shorter schedule today than we've had in the past, and I'd like to announce that our daily press conferences will be discontinued over the weekend. Our next press conference is scheduled for Monday, March 23rd. It will be at 3:30 this same time on Monday, March 23rd. We also plan to discontinue daily briefings unless there's a significant change in the event and we need to update our communities. We'll reassess on Monday and make an announcement on Monday's conference as to whether what that schedule might look like for next week. We acknowledge that some of there's folks on Facebook feed, the Linn County Public Health page, are having difficulty hearing the audio. We continue to work and improve the sound. In the meantime, we'd like to announce that the summary of today's press conference will be available and posted on Linn County Health's website following the conclusion. The website has Google Translate functionality, which will enable translations into other languages. The last announcement I have is our PPE donations. I want to acknowledge the public's help and thank every one of them for donating PPE, personal protective equipment, to us. We are in the process of gathering that and inventorying it and determining where the greatest and highest priority of that need goes. So thanks to everybody who has donated. We're very grateful, and it will go a long ways towards protecting our responders. We will be distributing that PPE, or personal protective equipment, just as soon as we can get it inventoried and we can get it distributed. So thanks again for everybody and their donations. Today, first on the agenda, from Linn County Public Health, Linn County Public Health Public Spokesperson, Tricia Kitzman.
Good afternoon. I want to take this opportunity to remind our community members, especially the young adults who are returning from spring break, and to be diligent about self-isolation, monitoring yourself, your family, for signs and symptoms of illness. Things here at home may look and feel a little different than they did last Friday. But one thing I can assure you that has not changed is the outstanding resilience this community has for displaying the togetherness and the support throughout our community. I know several of our community members continue to feel anxious and uncertain. We are here for you, care about your mental and physical well-being. We will get through this. Linn County residents are doing an outstanding job protecting one another. This is keeping our most vulnerable and frail residents safe. Effective March 19th, the healthcare providers are required to immediately report a positive and negative COVID-19 testing results. What this means is all COVID-19 tests that are performed will be reported to the Iowa Department of Public Health. This will help us know how many tests are being done locally and statewide. We know we have COVID spreading in our community and throughout the U.S. It's diligent for us to continue to do social distancing, isolating ourselves if we're sick. We continue to work with and encourage our business partners to monitor employees. It's important to ensure healthcare workers stay healthy. We're asking employees to go home when they are sick is an important role for all businesses to play. They're helping keep our community safe and healthy. Public Health appreciates knowing our businesses are doing their part to ensure the safety of their employees in our community. We recognize that some small businesses were not mandated to close, but made the brave decision to do so anyway. Thank you. We applaud that. To encourage social distancing, I've been asked to provide an update by some of our partners. LAP Aid, that is the Linn Area Partners Active in Disaster. 211 will be expanding resources to be able to be a reliable resource for information for our community. Grantwood AEA, school meal locations for their 7-county area are posted on the Grantwood AEA's website, grantwoodaea.org. Again, if you are able to, I encourage you to please donate blood. Please contact your local blood center and make a scheduled appointment prior to going to help avoid a blood shortage. In closing, Public Health is the silent partner behind the scenes protecting our community every day. During this public health emergency, we will help lead the way and continue to prevent disease and implement response strategies. I want to assure you that we are continuing to work with our local and state partners. And again, I want to express my gratitude for our community, our partners, and our elected officials. Thank you.
Next, I'd like to introduce Chief Medical Officer, Unity Point Health, Dr. Dustin Arnold.
Good afternoon. As surgical and medical supplies are in short supply, we do have adequate supplies in both hospitals. However, Unity Point is releasing a press notification this afternoon describing a program of asking for sewers to volunteer their time and their skills to create, if you will, a surgical mask. And this is exciting for all the people that are at home and like to sew. You can find the instructions for that on unitypoint.org. And once the masks are completed, there'll be a collection box outside the St. Luke's Healthcare Foundation, which is on A Avenue and 10th Street, the old Mr. Nedelecki's old radiator shop. Additionally, we've had some inquiry regarding the tent that we have outside our ER. That is present to help provide cover or shelter for screening individuals if there's a little backup at the ER. We are screening individuals and addressing whether or not they have a concern that might be infectious and then treating them appropriately. I'd like to say one last message to the community. From both hospitals, we're very grateful for the patients and their families who've been understanding as we've canceled surgeries and postponed them, and we understand the discomfort and disruption of their schedule. But for every surgery that we've postponed, we've at least 4 personal protective equipment supplies are preserved in the event that we do have a patient surge. So we are grateful for your patience and your support. Thank you.
Thank you. Joining us today from the Linn County Board of Supervisors, Supervisor Stacy Walker.
Good afternoon. I want to give an update on the situation about our property taxes. So on March 16th, the Linn County Board of Supervisors requested Governor Reynolds extend the March 31 property tax due date in response to COVID-19. We learned today that Governor Reynolds has honored this request by temporarily suspending the penalties and interest for delayed property tax payment until the end of the governor's declared state of disaster emergency, which is currently set for April 16th, 2020. Today's authorization is part of the governor's additional state public health emergency declaration, effective immediately, that provides regulatory relief to Iowans impacted by this public health disaster. So what this means is that residents now have until April 16th to pay their property taxes without accruing late fees or penalties. So here in Linn County, while our treasurer's office is currently closed to the public to protect the health of the public and our staff, we are still working, and we do have the capabilities to receive property tax payment. There is a drop box outside of the Public Service Center. Payments can also be made online at iowataxandtags.org or by calling the Linn County Treasurer's Office at 319-892-5500. I want you all to know that the Linn County government is still waiting on a response to our request to the governor's office to relax or waive some of the Medicaid waiver requirements that would allow our Options of Linn County staff to provide in-home care to the Options consumers who are now at home. Of course, this step would allow family caregivers to return to their jobs knowing a qualified provider is caring for their loved one while they are at work. And finally, I want to end by saying this. We are now at another weekend. And I know from talking to the city manager and the city of Cedar Rapids that residents here in Cedar Rapids and around the county did a wonderful job of staying in, not going out to bars and being in close spaces, really practicing the social distancing we've all been talking about. And that served us well. But we are not out of the woods yet. So I would encourage folks to continue to practice social distancing, even heading into another weekend, to keep ourselves safe and to do everything we can to get through this ordeal as safely as possible. Thank you very much.
Thank you. Joining us from the City of Cedar Rapids, Cedar Rapids City Manager, Mr. Jeff Pomerance.
Thank you. A brief report from the City of Cedar Rapids. We all know that business, local business in particular, has been greatly impacted by the appropriate response to COVID-19. So I just want the businesses out there to know that we understand that, and we're working hard along with our partners locally as well as at the state and federal government to advance programs and initiatives to help business, small business, medium, large business, come back from this very, very difficult situation. We've been in contact just today with Debbie Durham, Director of the Iowa Economic Development Authority, in order to assess the impact of the pandemic in Iowa. The IEDA is asking all businesses to complete a survey, and many of you have already responded to that survey. It's available through multiple means, but in particular, you can see it on the website of the iowabusinessrecovery.com. The site offers the most up-to-date information and resources for businesses impacted by COVID-19. There's also a link to an email address where businesses can submit to the state of Iowa specific questions to the IEDA. The city is also in contact with local businesses, doing our part to work with the backbone of the economy of Cedar Rapids. And we're providing those businesses with updates and resources. Obviously, we have a very large business community in Cedar Rapids, so we certainly haven't gotten to everyone, but we will be in contact through direct communication, our website, and a variety of other social media means to give updates on exactly what citizens and businesses need to do in order to get back on track from an economic perspective. Most of this information will be on the city's website, so I urge you to keep an eye on the website. It's being updated. It's very fluid, like this situation, but that's at cedar-rapids.org. The Greater Cedar Rapids Community Foundation, in partnership with Hall Perrine Foundation and the United Way of East Central Iowa, is also opening a disaster response fund to provide a vehicle for the community to respond to the impact of COVID-19 on vulnerable populations and on organizations as a result of the crisis. The Community Foundation will work to determine gaps in local, state, and federal funding, and local community needs will be addressed to the best of our ability in order and through a grant process. So I just think it's important for everyone to know that as we deal with the impacts of this health situation, of this health crisis, we're also looking forward and talking to partners. We're working closely, certainly with our medical community, but at the local government perspective, with the other communities, with Linn County, with the state, and as I said, the federal government, to address the needs and fill the gaps where possible. We're just at the beginning. And so as we look at how to protect the health and welfare of our city, we're also, again, looking forward to how we address the economic needs. We're not going to be able to do it alone. We're going to need lots of help. We're going to need this community to pull together as we have many times. In thinking about the various floods we've had, the flood of '08 and the flood of '16, there were other communities impacted, certainly. But Cedar Rapids had very significant impact. And it was easy for others to look at our city and say, how can we help? Whether we're in Des Moines, other parts of the state, the federal government, the state government, and our own community. In this case, we have a situation where the entire world is impacted. And so it's not, as we all realize, it's not a Cedar Rapids situation, it's a worldwide situation. And so it's going to be a challenge to raise the kinds of dollars that are needed, whether it's from the federal government, the state government, or our local community, because so many others are feeling the pain, and some to a far greater extent than we are at this time. So that's just a bit of perspective that we need to keep in mind, is it's obviously not just about us, it's about so many others. In the area of trying to create opportunities for our young people for activities, particularly as they've got a bit of time off, I wanted you also to know that our Cedar Rapids Library is hard at work. The physical building is closed, but the library staff has been working hard on developing virtual programming for all ages on Facebook Live and YouTube. So it's not just about the kids, it's for all ages, but we're focused on the kids. And the Cedar Rapids Public Library has a wide variety of free resources, ebooks, magazines, audiobooks, streaming music, TV, movies, available to anyone with a library card. And all this information and all this material can be accessed at home. Phone and email service continues with information professionals answering questions from the library and making library cards available over the phone for new users to e-services. Residents are encouraged to use these library services available at crlibrary.org, crlibrary.org. So we're all working hard to serve our community. I appreciate the collaboration and the support from the community, from the other governments, and have as healthy a weekend to all of you as we can possibly have under these circumstances. Thank you so much.
Thank you. Before I turn it over to questions again, for those that were joining late, I want to remind folks that the daily press conferences will discontinue over the weekend. We'll start again with this next press briefing Monday at March 23rd at 3:30, and then we'll plan to have a schedule out after that. So with that, I'd be happy to take any questions, and we have one that came in on our text messaging capability. So stand by for Caitlin Emmerich with Linn County Public Health.
This message is from Grace King at the Gazette. Has Cedar Rapids Transit shut down before? Do they have limited service during the flood? And how do people get to the doctor or get food if they don't have transportation?
At this time, Cedar Rapids Transit continues its schedule as we've talked about before. We've suspended fares. We're asking individuals to enter buses from the rear of the bus. Certainly, this could change. We're very much evaluating Cedar Rapids Transit. Obviously, when you think about a bus, it's close quarters. We've attempted to limit the number of individuals on a bus to the driver and 10. So it's putting some severe stress on the system. We're monitoring what's happening with other transit systems around the country, around the state as well. So the answer is business as usual, as has been described, social distancing being emphasized, but that could change. We would not simply cut that service off if we were to make the decision to suspend normal bus operations. We are in some discussions with NTS, Neighborhood Transportation Services, about providing backup services for critical rides to the community. So this is, again, a fluid situation. We're monitoring it. We need to make sure we have the personnel, and we need to make sure that everyone is safe, and we'll have a further discussion about this next week. Thank you.
I want to also speak to what Linn County Lifts has been doing during this time. As many of you know, Linn County Lifts has been primarily a bus service that serves folks who are mobility limited, the elderly population, and folks who live outside of the greater Cedar Rapids area. This service is focused on making sure this group of individuals is able to get to the grocery store and probably most importantly to get to their medical appointments. So Lifts is still providing these priority bus rides for people who are in need of getting to medical appointments. We have also suspended the fares for this service, but we also have transitioned some of the Lifts services to meet some of the logistical needs in the community. So what this means is Lifts services are now collecting food from around the county, taking those meals to Horizons, and Horizons is sort of making sure we redistribute that food to people, to vulnerable communities, to people who really need it. So in addition to the transit services that the City of Cedar Rapids offers, Lifts is able to still serve the vulnerable community that they do.
We received another question asking for a clarification on the current status of personal protective equipment, or PPE, from the hospitals.
Both hospitals, all 4 hospitals in the corridor, the University of Iowa and University of Iowa City, we have an adequate supply of personal protective equipment. However, we've extended that adequate supply with the cancellation and postponement of surgeries, as well as the attempt with the isolation and people not out and about, and flattening the curve will extend that supply. The mask that we have at the program, the sewers that will volunteer to make those is reassuring, and will just be present if and when we would need them. I would say the thing that keeps me up at night is if this surge would happen across the country all at the same time, everybody would need those masks, and it would be difficult to get them. But I can assure you we have an adequate supply to treat any medical condition that might be thrown at us. Thank you.
Thank you, Doctor. Also, I would just tag on to that, our first responders and some of our paramedics, firefighters, and police officers are going to need that PPE as well, so that when they respond to the community, they have that kind of protection as well. So we're working to supply them as well. So it's not just, it's important that our medical professionals have it, but also our first responders. So thank you for that. Any questions?
Yeah, I have a question for City Manager Pomerance. I believe you said on Wednesday that the city staff was looking at an aid package for small businesses. I know you did touch on the topic, but I was wondering specifically if you guys have made any progress on what that could potentially look like.
Well, we talked to a number of community partners. We've actually assigned our economic development coordinator, Jasmine Almoyed, to help put that effort together. And seeing the devastation, no local government would have the resources to certainly deal with the problems alone. We're going to need lots of help from the federal government, the state government, and local governments. But we're going to do our best to first understand what the impacts are. And again, this is a very new situation. We don't know how long this is going to occur. As far as having, for instance, bars and restaurants and small businesses closed. And so we're going to have to assess that and actually put a package together. Not necessarily all a financial package, but just how we access all the opportunities that are out there. Just coincidentally, we're hiring an individual to help us with our workforce. A couple weeks ago, the big concern in Iowa was the very, very low unemployment rate and being able to attract and retain workers to Iowa. And so the individual will be starting on Monday. She works directly for the Economic Development Coordinator, Jasmine Almoed, but she's going to be in charge, and she has a lot of experience within the local community at putting this initiative together. Thank you.
Any other questions?
Dr. Arnold, just on the sewers, I guess with these masks that you're asking them to make, I guess how will they work just as if you would get them from the regular manufacturer, I guess, and why it's important for them to, I know that yesterday it seemed like we were talking about you guys were in need, and now it seems like you're getting some donations and stuff, but I'm just curious to know how this is going to kind of help further what you guys will need.
For several reasons. One is it is made of the instructions. I'm not a sewer, okay, but so the instructions on the unitpoint.org that has that does explain what sort of material is needed and the pattern that will make it compliant with protecting from the particulates that we want to protect from. The long-term benefit of a cloth mask or whatever the fabric is, I don't know what it is that it can be reused. And so that will extend well through this. As City Manager Pomerance and Supervisor Walker noted, this isn't a snowstorm, this isn't a hurricane, and it's affecting everyone. So we all just have a little anxiety about how long this will last, and will supplies be able to come in. That answer your question?
I do have one more. I don't know if Dr. Arnold would answer this or if this is for Tricia. I think some people are a little confused as far as what's the guideline as far as where's the line where it comes to somebody who is affected with the virus as far as patient privacy, and then letting people know where that person maybe was in the past few days, so that or where they may work, or what, I guess where's that line as far as privacy, but also in what people may be needing to know where that person may, resides or works, or, just for their safety, I guess.
You guys are killing me with these 5-minute long questions. I'm gonna recap it and let me make sure I'm capturing what you're asking me. You wanna know about contact tracing. You wanna know when we have a case, where's that fine line of what do I get to share with the community and what I can't share with the community because of HIPAA and all kinds of other privacy. Is that it?
Right.
All right. Phew, thank you. So here's the deal. When we have a case or somebody who has a communicable disease, a report of it, a positive case, and I'm going to talk in terms today, not of necessarily COVID, but any communicable disease. So it could be salmonella, it could be pertussis, it could be an STI, or COVID-19. Local public health is notified. What we do right away, and this is what we do every day with any communicable disease, is we contact the provider, make sure that the provider has talked to the patient. Does the patient know that they have this disease? Yes or no? We make sure that the patient has had the opportunity to do the clinical side of it. Then we follow up and we talk to the patient. We ask them who they've been around. Based on the disease, we need to do a follow-up on time, where have they been, because many people know in measles, it's a very big deal because it's airborne. This is not, COVID-19 is not airborne. Measles is. It's a different beast. We want to know where you've been, who you've talked to, who lives in your household, where do you work, and those are all questions that we do for every communicable disease we follow up on. What we do from there is we contact those individuals. So if I came down with COVID-19, local public health would call me and ask who lives with me. My husband. Where do I work? I work at Linn County Public Health. Who do I have direct contact with in the last 7 to 14 days? I provide that information to public health. What then happens is public health starts reaching out to those individuals. I am not, because of privacy issues and HIPAA, which I think we're all very familiar with, I am not allowed to go to the public and say, hey, by the way, John Snow has COVID-19. He works at blah, blah, blah. He went on the bus, blah, blah, blah. But I can, when I work with local partners, be able to disclose some of that information. The situation with the self-identified individual who came in and was around Cedar Rapids, we worked with the business. They reached out to us, wanted us to make sure they felt an urge to educate the community and the patrons that came to their business. But had that organization not wanted to partner with us and share that information, I am not allowed to share that kind of information on where those individuals work, have traveled to, and all of that. That is a partnership. That is their confidentiality. Businesses are protected as much as an individual is.
So just kind of a follow-up, so a big thing is you're also asking businesses to kind of maybe, if they feel it necessary, that would help you.
That would help me. If they approach me or if they know of an individual that is sick, they also, especially if we're talking businesses with employees, if an employee of a business has COVID-19, it's very difficult because there's that fine line of HIPAA confidentiality. We're talking medical records here, of disclosing that. If it's an agreed upon between the patient, the employer, and public health, yes, that can be shared. But it has to be agreed upon about all three. If one of those within that system decides that I don't want to say this, or I'm not comfortable with my organization being identified as having a COVID-19 employee, then nobody gets to go public. So it's kind of an all or none. Yep.
Do we have time for one last question? Seeing none, this will complete today's press conference. Thanks for your time and attendance. And again, Monday, March 23rd, 3:30, same time as next week. Have a safe weekend, everyone.